She just doesn't want to breathe by herself.
On this episode,
We don't know why she's not breathing.
Romy faces multiple emergencies.
We need to move fast to make sure she's getting oxygen and the anesthetic.
When Lucy the Groodle crashes before and during surgery.
Her blood pressure has just started to drop.
Oh, I think we've found the problem. Pretty dirty.
And Andrew treats a seriously ill goat that could be infested with a life-threatening parasite.
Well, we just want to rule out worms first. Worms are a real problem for goats because they can cause diarrhea. They can become really, really sick and then can actually die. There you go. Feels good. I just really love animals. Hey mate, good boy. And I love the joy they bring to our lives.
Hello.
Oh, it's adorable.
But first on this episode,
Look at that. This is a really significant injury.
Holy jeez.
I know.
That's mind-blowing. It really is mind-blowing.
Andrew and wildlife carer Nat can't believe their eyes.
There's a big ski jump right in the middle of the spine. He should be completely paralysed.
Ah, little pumpkin, what's going on?
In the Australian coastal town of Ulladulla, wildlife carer Natalie has brought a badly injured native animal to see Andrew.
Poor little guy. Little pumpkin was found on a very hot footpath, just lying there doing nothing. He was very dehydrated, very flat. Hasn't had a whole lot of movement going on in his back end. When I saw him, I was quite concerned about him.
G'day Nat, come on in.
Excellent.
We've got a whole range of wildlife in here. You get wallabies, kangaroos, possums, birds, lots of reptiles, snakes. We've seen some big sea mammals, we've been to a whale stranding. A bit different to being a city vet, that we do get to help creatures out in the bush. It's part of the job I really love. What have you got in there?
I've got a little possum, little ringtail possum.
Oh, cool.
Adult male.
Yeah.
Who's really not been very well overnight.
Okay.
Not a whole lot of movement going on and just really worried about his welfare, and so...
Let's check him out.
Hello.
Oh, it's adorable. He looks pretty bright.
He is very bright this morning.
Yep.
So gave him fluids overnight, but I'm really quite worried about the movement in his back end at this point in time.
I'm just going to grab him out. We've got to be really gentle, obviously not to hurt him, and we want to make him feel as comfortable as we possibly can. Have you given him a name at all?
This little guy we've called Pumpkin.
Pumpkin, yeah,
Yep.
cool. The first thing when Nat brings Pumpkin in is how cute he is. Big brown eyes that look straight up at you. He's obviously so adorable that you can't help but fall in love with him straight away. And you're right to just steady him. I just don't want him to fall off at all.
No, that's all right. Keep their head covered where possible, just to try and reduce that stress.
Yeah, you're just going to make sure that his pupils are dilating. Just make sure he hasn't had too big a knock on his head. These are working okay. His colour's still nice and pink as well.
Yeah.
And there's no obvious trauma to the mouth. All the teeth are intact still.
Good.
I'll turn him back if you don't mind covering his head again. Just feel for any obvious breaks.
Yeah, yeah.
You can see he doesn't have much movement in this one at all though.
Yeah, so he's dragging both of those legs, unfortunately. Certainly a bit of a mystery, this little guy.
Yeah,
Be interesting to see what he does have going on.
So what I think we should do is take an x-ray.
Okay.
Just to make sure we don't have any obvious breaks, or see if we can work out what's going on with him.
Yeah.
I'll just have a listen to his heart.
A trained nurse, as well as a passionate wildlife carer, Natalie knows the X-ray images might not reveal a bright future for tiny Pumpkin.
The X-ray should be able to tell us if he's got a fracture there, and then that should be able to tell us then whether it's something that can be rehabbed or whether it will be a sad end for this little guy. Hey, baby.
Hey, you're being a good girl, Lucy. You are.
Elsewhere at the vet hospital, Roger has brought in 10-year-old Lucy after noticing a worrying problem on one of her ears.
She had a haircut yesterday, and fortunately she did, because it showed that on her right ear that she has like a large swollen area, like a big blood blister, I guess, quite big. So it's full of fluid. Come on, Lucy, come back here. Come on. Lucy definitely is a very special dog, and we care about our dog, we love our dog, And we've got 3 sons who absolutely love the dog, so we're concerned with her well-being.
Hi, Roger.
Hi, how you doing?
You?
Yeah, great, thanks.
Nice to see you again.
Yeah, tough.
Today, Dr. Romy will be taking care of Lucy.
Why don't we get her through and we'll just check her?
Okay, awesome. Come on, let's go. Good girl.
Good girl, Lucy.
Good
Oh, you know the
girl.
way. Lucy is a great patient. She's so easy to handle. She's so lovely. She loves cuddles, and I'm so happy to be her vet. So the problems this year, I can see.
Yeah, you can see a massive difference between that ear and this ear. Like, look how thin that is.
How long has this been like this?
We only noticed it yesterday.
And you noticed
So,
it yesterday. Has she been scratching?
Yeah, she's been a bit shaking her head around and stuff.
Yeah, okay.
Yep.
So I do think it's probably an oral hematoma, which is essentially just a collection of blood from the vessels of the cartilage of the ear.
Yes.
And that blood clots, they just get stuck within the cartilage and between the cartilage and the skin. An oral hematoma happens because of sort of trauma injury to the vessels. So it could be from playing and they just kick their ears, but a lot of the times is due to ear infections, and I think that's what's happening in Lucy's case. She gets recurrent infections. It's not life-threatening, but it's definitely annoying and painful. Okay, I can see that one's quite inflamed and there's some discharge inside.
Okay.
So I believe the cause, sorry girl, is an infection. But we'll have to swab their ear, have a look under the microscope, and then we'll know for sure what's going on. There's a few options when it comes to treatment. I believe the best option is surgery. The other option would be to drain it with a syringe. But to be honest, just draining that blood, the vessels are still broken, they're going to release blood again. And if we don't do surgery, what happens is it will heal with a lot of fibrous tissue and it will look like a cauliflower ear. So definitely surgery is the best option.
Okay, sounds good.
Sounds good?
Yep, I'm happy with that. We don't want it reoccurring.
Perfect.
Having decided on surgery, Roger asks if 2 benign lumps on Lucy's body can also be removed, while his beloved Groodle is under anaesthetic.
Obviously at her age, there's a little bit more risk than there usually is, but look, there's always risk under anaesthetic at any age.
Our boys have grown up with Lucy. Yeah, she's a part of our family big time, so I would be very sad if she didn't come through the surgery. So yeah, that is a concern.
Hey,
See you later, Lucy.
See you later.
You're going to be good.
Come on, Lucy. Bye, Roger.
See ya.
Helena, we've got this little cutie in here called Pumpkin.
Andrew is about to x-ray little Pumpkin to find out why the tiny ring-tailed possum has virtually no movement in his back legs.
There you go. Because Pumpkin is so small, finding a vein to deliver the anaesthetic is very difficult. We don't want to cause any more damage by restraining him too hard, and we do want to make sure that he's not very stressed. So the safest option is to use a mask.
Ready?
Yeah. X-ray. Look at that, Helena. As soon as I see the X-ray on the screen, I know there is a pretty big injury. So you can see a problem with the spine straight away. It's really dramatic.
Andrew takes another X-ray from a different angle to confirm little Pumpkin has a life-threatening spinal issue.
We're just going to turn the anaesthetic off.
As vet nurse Helena takes Pumpkin off to recover from the anaesthetic, Andrew invites Natalie, who rescued the tiny possum, to view the shocking results of the scans.
Holy jeez.
I know, pretty obvious, isn't it?
That's amazing.
This is where the problem is. There's that little bit of an S-bend happening just here.
That's mind-blowing. It really is mind-blowing.
We'll start by making an incision all the way through the hematoma.
Romy and Nurse Ash are sedating Lucy for surgery to remove blood clots from the Groodle's right ear.
Good night, Lucy.
But as they put their patient to sleep,
But she just doesn't want to breathe by herself.
the 10-year-old appears to have an adverse reaction to the anaesthetic.
Lucy's breath holding at the moment, which is a bit of a concern. Now there's many things that can cause this, but we need to make sure she's getting oxygen and at the same time that she's getting the anaesthetic. So we need to move fast. We don't know why she's not breathing. It could be related to the machine that alerts us when she's breathing or not. So we decided to move Lucy to our theatre, to a different anaesthetic machine. Now that she's hooked up to the new machine, Lucy's breathing on her own. That means we can all take a deep breath and relax. I don't know. We'll see what's in this.
While Ash prepares the infected ear for surgery,
To find out what was causing the infection.
Romy examines the sample she's just taken to determine the type of infection Lucy has and the medication she'll need to fight it.
I'm seeing a lot of yeast and some bacteria as well, some cocci.
Having found out what's causing the hematoma, Romy is ready to begin surgery on the 10-year-old's ear to try to stop it from happening again.
The biggest risk for Lucy is her age. I'm not that concerned about the procedure, it's pretty simple. It's more that I want her to tolerate the anaesthetic. 10 years old, we have to be careful. My plan is to incise that hematoma, so that squishy cushion pillow thing. We're gonna slice, get all the blood out, we have to clean it and just make sure we get rid of all the clots. Can I grab some flash, Ash? So we're just trying to flash all the clots. So much more coming. It looks like we got it all out. It's always going to bleed a little bit more, but that's what the stitches are for. It is a little bit tough going through cartilage, as you can imagine. That's why we need the big needle for.
But just as Romy starts sewing up the wound, Lucy's condition suddenly deteriorates.
Romy, I'm just a little bit worried. Her blood pressure has just started to drop a little bit. And yeah, I'm just not very happy with where that's sitting.
When the blood pressure is not within the normal limits, what can happen is that the blood flow to the most important organs, kidney, liver, it can be compromised. At her age, that's a concern. Can we give some IV boluses?
Yep.
We'll do that and then we'll reassess.
That's amazing.
Yeah. So because
Wow.
X-rays are two-dimensional, we have to do perpendicular angles.
Andrew and wildlife carer Nat are shocked by X-ray scans of a spinal injury that should have incapacitated tiny ring-tailed possum, Pumpkin.
In this area here, we have a big problem.
That's this spot just there?
That one of those
That's-
vertebrae is sticking straight up
So it
to the
should be-
sky. Yep,
Yeah, it should be
directly
like
in
that.
line with the other one.
Instead of sort of doing
Like
that.
some train tracks that are going along
Wow,
like
that
that.
is just amazing.
The injury is in Pumpkin's neck area. There's a big ski jump right in the middle of the spine. Looking at that X-ray, I reckon he should be completely paralysed.
Why though then has he still got such good movement of his tail, and why can he still move his legs if that's what's going on further up?
I really don't know.
Like that's
a mystery.
That is just,
Bit of a fighter, isn't he?
oh yeah, definitely a bit of a fighter. When I saw that X-ray, I was horrified. I couldn't believe that he was alive. I couldn't believe that he was able to do the things he could do when he had that sort of injury. It took my breath away. I'm absolutely amazed.
Generally, if we have that sort of position, you would think the spinal cord would be fully severed
Yeah.
and not be able to use the back legs at all.
That's right.
But I think he might be a bit of a miracle.
Yeah, I mean, he's in the cage this morning, he's climbing, he's doing pretty much all the normal possum things. He's
Yeah,
just
sure.
not using those back legs properly.
Yeah. Pumpkin's injuries could be caused by a whole range of things, from a dog or another animal that's attacked him, or it could have fallen from the tree or been hit by a car. They're generally the main things that we do face when we're working with wildlife with that sort of injury.
There,
Can't see any fractures along here at all.
Yep,
You can see
good.
along the tail, the vertebrae are all
They're
the same
beautiful.
size and
Yep.
yeah, in good position. It's
Okay.
really just in that thoracic, the chest area, you can see his big problem.
If Pumpkin's injuries are too severe for him to live a normal life, he may need to be put down.
This is a really significant injury, so let's go and chat about what to do.
Okay, for sure.
good, Ash?
Yeah, everything's all good.
Great.
In the operating theatre, 10-year-old Lucy's blood pressure thankfully has stabilised.
Obviously being older, we don't want to keep them under for too long, but at the moment she's doing really well.
Great.
It's a huge relief for Ash and Dr. Romy.
She's coping with the anaesthetic nicely, her heart rate is nice and steady, and she's breathing really well by herself too.
Good news for Lucy.
With her patient's vital signs back to normal, Romy quickly finishes stitching up Lucy's ear after removing several worrying blood clots.
This is our last stitch. We've done a few. I always go a bit extra in these cases because I don't want it to happen again. At the moment, everything's going well. I'm just concerned because I still have 2 other surgeries to perform and I don't want her under anaesthetic for too much longer.
Ash quickly prepares the areas surrounding 2 lumps, which Romy has promised Lucy's owner Roger she will try to remove.
Time is definitely a concern at this stage, so we're trying to do it as quickly as we can, especially because of the blood pressure that was sort of a little bit up and down. We just want to get this done as soon as possible. If at any point we believe it's no longer safe, we will be stopping surgery. The lumps that we're excising right now are not actually a concern. They're benign, they've been assessed in the past. So I'm going to get a different Ash to do the bandage.
Concerned about a prolonged anaesthetic, Romy calls in another nurse, also called Ash, to help with Lucy's ear, while she gets to work on removing the second lump.
So this is a lipoma. So it's just a fatty lump. They're just bothering her a little bit. She's chewing at them, and so it's easier to remove them once we're already under anaesthetic. Good thing about these ones, what makes them easier is that they're usually encapsulated, so we can just tear it. That's how we remove it, and then it's all out.
Despite a few anxious moments, Lucy has made it safely through surgery.
We are sort of running against time, so this is quicker than placing sutures. I'm actually pretty happy with the job we've done today. Removing the lumps was easy. We didn't really have to take margins, which means we didn't have to take much of the tissue around because they were benign. This is her ear medication for the infection into the ear canal. All done. That will make you feel better, Lucy.
With ongoing medication, hopefully Lucy's troublesome ear infections and hematomas are behind her.
Now all we have to do is wake Lucy up and get her ready to see her parents again. Come on, Lucy. Good girl.
It's definitely a huge injury. There's been some sort of major impact.
As Lucy recovers, Andrew and Natalie must decide if Pumpkin the possum's spinal injuries are untreatable and he should be euthanized.
Hey, little guy.
I think given the injury itself,
Yep.
normally I'd say it's not going to end very well.
Natalie rescued Pumpkin just 24 hours earlier and can't bear the thought the tiny helpless creature might not survive.
You get really, really attached to these little guys. It's really hard seeing them in pain, and yeah, they break your heart.
I guess the best option would be if we could try and rehabilitate him yourself.
Yep.
Oh, you're very competent at that, I know.
Given the movement he's got at the moment, what's your advice as far as giving him the best rehab? Like, what do I do with him? What's he going to need?
I think the first thing we need to do would be to give him some pain relief, just to make sure he's not in any discomfort at all.
Yeah, for sure.
And then we'll just do very gentle, soft exercises as we go along rehab-wise.
Sure.
A little bit of mild physio.
Okay.
So it's going to be a lot of work, but if you're prepared to do it, I think we should give him a chance.
Okay.
And just see how we go.
Yeah, beautiful.
Natalie's got a big job ahead of her to rehabilitate Pumpkin. With an injury like this, there is a big chance that Pumpkin wouldn't survive in the wild. So it's not a guarantee that he's going to be able to be released. So the next few weeks really are crucial. Okay, my little pumpkin, best of luck. We'll check him again in a couple of weeks.
Beautiful. I'm certainly prepared to give Pumpkin a chance, to take on that responsibility, to give him the best possible outcome. Beautiful.
See you
Thanks
later.
very much.
See you, Pumpkin.
To have any movement at all is incredible. I'm amazed that he's survived. I'm amazed he's able to do the things he can do. It's going to take some work, but it's certainly going to be worth it if we can get him back out into the wild.
With a busy and stressful morning behind them,
Let's get into it.
Andrew has organised a special lunchtime treat for his staff.
So every week we have yoga down here by the harbour.
All right, guys, we'll do 4 on each side.
Mental health in our profession is a really big problem, and I just want to make sure I can do everything I can to make the staff comfortable.
To spice things up, Andrew's invited a few cheeky patients to join the fun.
Hello. Thank you so much for bringing the goats.
No worries.
Thank you.
Though not everyone's so keen on the early start.
I think it's so good. It's great for bonding with the team, but at the same time, it's so good for our mental health to get to have a break.
Okay, everyone, enough pats. Let's do some yoga.
Long, deep breaths, back and side ribs. Inhale, exhale. Exhale. Really steady. And down. Inhale, exhale. Let's do one more.
While some are embracing their inner peace,
Press forward, squeeze your bottom, lift your gaze. Might move him back a bit.
others are finding it a little more challenging.
Goats are obviously super cute. They're cheeky, naughty.
Oops, nearly got you there.
You can't help but laugh when there are goats around.
I kind of heard her come over and she was sort of nibbling around my face, and then yeah, she did end up starting to like take a little bit of a step on me, which was really fun.
I think it's more fun than relaxing, but it's not as relaxing as regular yoga when you have a goat up your back. But
Feels good actually. Yeah, it's quite nice.
definitely more fun.
Stand up now and we'll finish with a little bit of a laughter yoga exercise. So let's smile down. Thanks everyone, well done.
I need one. I just realized I need a goat. I need a mini goat. Everyone needs a mini goat, right? Lucy, walkies, you're up. Hi, sausage. Do you want to see your dad?
Romy has come back from her yoga break to find Lucy slowly waking up after multiple surgeries.
Good girl. We still have some more waking up to do.
As Romy waits for the groggy 10-year-old to recover,
Come on, Lucy girl.
her devoted owner Roger can't wait to see his much-loved Groodle after an anxious day of worrying.
You are always concerned because it's something that you love, so yeah, I'll be glad to see that she's well. And hopefully, I mean, she's 10 years old now, so hopefully we can get another 5 years or so maybe of enjoyment of her would be good.
Who's on the other side?
Oh,
Who's
look
that,
at that.
Lucy? Oh, we're running.
Oh my gosh.
Who's that, Lucy?
Oh my goodness
Hey,
me.
Sausage. That's not the same Lucy you dropped off.
Definitely
but
not, no.
She'll be back to herself.
She's amazing.
She's all recovered.
So, how long do I need to leave this?
Because we've done a few things,
Yeah.
so that's where we remove the
you have,
lumps.
yeah.
So I don't want her biting that. Within a few days, then you can take it off, but only when she's supervised.
Okay.
Main thing is to keep putting the drops into here twice a day, all the way in.
Yeah.
But it's
Okay.
just in enough so it doesn't fall off.
And then
and
squirt.
then massage it down a little bit.
Thank you, Doc.
Lucy is one of my favorite patients. She is super lovely. She's such a good girl. Thank you for trusting us, Roger, with your little Lucy girl. I'm sure it will be an easy recovery for her.
You've done a great job, Romy.
Thank
I
you.
look forward to seeing you next time when we have need. Come on, Lucy, let's go.
Just
Outside.
the
Come on.
needles, nothing else.
Yep, let's go. Well, she's very keen to go.
Bye, Lucy.
Thank you, Romy.
Thank you.
Come on. Come on, in you come. Yeah. Sit down. Come on, sit down. Okay, Kipper. That's the girl.
With goats already making their presence felt today, Farmer Wallace has arrived with 10-week-old Kipper, who has a bad case of the runs.
Kipper's got, we'd call it scours, but diarrhea. She's had that for a couple of days and I'm just a bit worried that she's dehydrating, and I just want to see if we can kill the bug and get her back to her mother.
G'day Wallace, who have you got here?
This is Kipper.
Ah, g'day Kipper.
Yeah.
Hello. Can we get her out of there, do you reckon?
Yeah.
We'll carry her in. Wallace was one of the first people that I ever met at the practice. He's been coming in here longer than I've been a vet, longer than I've actually been alive. He loves animals, so yeah, I'm really happy to be able to help him out. Come on in.
Right.
Come on through here, Wallace.
All right.
There you go. Hello. How are you? She's gorgeous.
Yeah, she's a lovely little goat.
What's she here for today?
Diarrhea, and a bit worried she might have been dehydrating.
Sure.
You know, she's losing condition a
hollow.
bit.
How long's it been going on now?
I think it's 3 days.
Okay.
Yeah. I've had them on a fairly good paddock, like a lot of clover and ryegrass, and since I noticed she was getting crook, I let her into a coarser paddock to get more roughage.
Yeah, sure. Diarrhea is a real problem for young goats because it can be caused by lots of different things. Infection, it can be dietary related, it can be a sign of other diseases. So we've really got to get to the bottom of it because they can dehydrate quite quickly, and then we have a really critical animal in our hands. Oh, I think we've found the problem.
Yeah.
You can see what's going on here.
Yeah.
She's pretty dirty, isn't she?
Yeah.
She's still wanting to drink from the mum?
I haven't seen her, but the mother's sticking close to her, and anytime she lays down, the mother's up there with her.
Yeah, sure. Dehydration can actually spiral really quickly, even if the goat comes in pretty good health. A matter of a day or two even, they can become really, really sick and then can actually die. The easiest way of telling dehydration is when we twist the coat. You can see the skin just goes straight back down to normal. If we're very dehydrated, it actually stays up like a little bit of a tent type of situation like this. So at the moment she's okay with that, but something that can certainly get worse over the next few days. So we do have to be careful. What I think we'll do is we'll do an exam. So we'll just give her a good check over and see what we can come up with Kipper. We'll just start at the little face. So what we check for is the colour of the gums. With worms particularly, we can end up quite pale because we're anemic, and they can cause diarrhea, but we can see we're still quite a nice little pink colour here. The gum colour is really important because if it's pale, that can mean that we're anemic or not enough red blood cells, and they can be very weak, and that can happen from worms, which is always the highest on our list with a little goat, through to a snake bite or infection or some diseases. So we check that first. The good news is that the lungs sound nice and clear, so there's no crackles or anything like that in the lungs. We do worry in a young one when they're drinking, they can aspirate and get like a pneumonia sort of condition, but we don't have anything like that going on, which is great. So we'll just take a little temperature and then we'll work out a plan. Her temperature's normal, Wallace, so that's really good news.
Having ruled out most probable causes, Andrew now worries an intestinal parasite could be the reason for Kipper's concerning condition.
What I think we should do will be to try and collect a little bit of a poo sample, and we'll have a look under the microscope and see that there are any worm eggs or anything like that.
Right.
Hopefully it is just a food related thing from the wet paddock, but we just want to rule out worms first. Worms are a real problem for goats because they can cause diarrhea, which is why we're here actually with Kipper, and so they can become very weak. They can get lethargy from it where they just don't want to walk around at all and can actually die from worms.
Do enjoy having animals. They depend on you, and I grew up on a farm and I've been around them all my life.
Wallace worries he could lose his affectionate young goat Kipper to a life-threatening bout of diarrhea.
Ever since she was born, you've been able to walk over and pick her up and pat her.
So what we're going to do, Wallace, is collect a little bit of feces from Kipper.
Suspecting a worm infestation could be the reason for the young goat's deteriorating condition, Andrew is about to test for parasites in Kipper's intestinal tract.
Sorry, mate. You'll be all right. So what we do is collect a little bit of that into that, and then we have a look under the microscope. Okay?
Right.
So
Okay. Yep.
I won't be too long. I'll just go and set that up, and then we'll be back with the results. There are many different sorts of worms. Goats are susceptible to quite a few of them. So we check out the poo to see if we can identify the eggs for a particular type of worm, and then work out a plan in terms of their prevention.
While Andrew searches for microscopic worm eggs, Wallace has an alternative theory for what could be causing the debilitating diarrhoea.
I think it's just with all the rain we've had, the conditions are just too good at the moment, and I think that's what's happened with her. She's just getting too good a feed.
It's actually great news. There are no worm eggs there at all. So I think Kipper really does have a reaction to so much lush grass. Because she's only a young little immature goat, their guts aren't formed very well, and so anything new for them or rich like the grass at the moment after all the rain can actually make them really, really scoury. You can set up your own pharmacy now, Wallace.
Yeah.
It's great news. There are no worm eggs at all under the microscope, which is excellent. So I think it is the actual grass that's causing the problem. We do have too much lush grass, like you said. So I think you're right on the money with your diagnosis.
Right.
You put me out of a job. Straight from the onset, Wallace actually suggested it was the green grass. I think we had to rule out worms and a couple of other things, but certainly the grass is looking like Wallace was actually right. What we're going to do is to try and give a couple of things to prevent it happening again. So we're going to go with some fluids under the skin. It has all the electrolytes in there as well as the actual fluid, so it will correct any imbalances that we have because of the diarrhea. So we'll give her this while you're in here in the hospital, and then over the next couple of days if you can give her the oral version, and then she'll hopefully brighten up pretty soon. I will give her a worming to be on the safe side also.
Okay.
Okay? Okay, mate.
That's good.
Yeah, sorry Kipper, ready? Good girl. We'll just hold that off. Well, I think she should be a bit noisier than that, shouldn't she? If she was bright and happy. So, it's definitely a little bit crook, but we'll get her back to good health. Yeah, sweetie. Kipper was a bit quieter than she should be. They're usually running around in this room if we do see them in here, and they're really vocal all the time. And that's a bit of a problem, because I think she probably is a bit spunkier than that generally. Here you go, sweetie. So this one's just the worming medication, so I'm going to drench her now. Just try and drizzle it in there, like that. There you go, sweetie. Good girl, Kipper. The drenching means to worm them. So worms are a real problem, especially when little animals are raised on properties and out in the grass. There you go. It's always a little bit messy like that. So from now on, Kipper will start to feel a little bit better, probably within 24 hours, and then by a couple of days' time, she should be running around the place back to her normal self.
There you go. On a bit of hay instead of a table.
See you, sweetie.
That's the girl.
Back on a hay. No worries.
All right.
Thank you very much. See you later.
I'm happy that it's not worse than what I thought, and everything's just checked out, so that's good.
It's just that back end that's that I'm really quite worried about.
Yeah, sure.
With around-the-clock care from Natalie, Little Pumpkin's condition has improved slightly. It's hoped with further time and ongoing treatment, the tiny possum's spinal injury may heal enough to safely send the native animal back into the wild.
Sit, Lucy. Sit. Good girl.
And a month after surgery to remove worrying blood clots from her right ear, 10-year-old Lucy has made a full recovery.
In her ear, there's no marks from stitches or anything like that. The vets did a fantastic job.
The affectionate Groodle is now totally pain-free and living life to the full.
Good girl.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.